I hope some of you were able to attend webinar one when we did it back in March. So this webinar was really around building the foundations, preparing for success, and getting started in private practice. We talked a lot about the vision. What is that 3 to 5 year vision? Why are you making this move into kind of private practice, and being very clear about that kind of vision for where you want to go, where you want to take it. Part of that process is your value proposition. So what is your clinic? Who are the patients that you want to attract? How do you want to treat them? What's that patient journey that you want to deliver for them? And what are your unique selling points? How are you going to compete in the market? You know, patients have choice these days. So just to make sure that you're very clear about the tangible benefits that you're delivering to your patients. We then talked a little bit about business planning and doing that kind of groundwork now. You know, when you are moving into private practice, and this is a really important point that Jane made on the webinar, which is it is still a business. You know, you're moving into, it's a business that you need to manage. You need to understand the revenues, and you need to understand the costs as well. And you need to do that groundwork now. That planning can be really useful going forward, especially when you're thinking about employing people, you're thinking about kind of technology you're going to bring into the business. We then touched on day-to-day operations, and you know, without going into a huge amount of detail, thinking about how your clinic is going to run on a day-to-day basis. So, you know, will you be bringing in a practice manager? Will you be bringing in a medical secretary? Will there be, how big will the clinical team be over time? And what about the kind of commercial aspects? So again, we'll cover this more on webinar 3, which is coming up in June. But this is really the summary of what we did. Now, this recording is available. Should you want to view it, do get in touch with the team. I'm very happy to run through it again with you as well. Now, one of the points that came up post webinar 1 was around CQC registration, and we had a lot of questions about this. So we're actually going to be running a 4th webinar, which we hadn't planned originally, in June to cover this. But this is, if you are thinking about moving into private practice, you may need to register with the CQC if you're intending to provide health or adult social care activities in England. It is a legal requirement, and there are a list of regulated activities that are on the CQC website, and I've also added a link here. Now, this is no small undertaking, and there's currently a 6-month waiting list should you want to go down that route. So if you are thinking about launching in January 2025, the idea is you really need to be doing the groundwork now. You need to be getting your application in by probably the end of May or June to ensure that you have that interview in place by the end of the year, and that you are successful and your timings are going to work regarding your launch in CQC. Now, we do recommend expert consultancy and guidance here, and we do work with people that specialize in this area. You know, what the worst case scenario here is you get to that kind of, you've waited 6 months for your kind of interview, you have that interview and you're unsuccessful. That sets you back another 6 months, which means you're not going to be bringing revenue into the clinic. So something to think about. And as I mentioned, we'll be covering this in depth in June. So yeah, June with our webinar then. So just a little moment on CQC, not to scare you at all. Okay, so today we're going to be talking about launching and marketing your medical practice. And there's terminology that Paul and I are very familiar with called the 4 Ps of marketing. There's actually 5, one which includes people, but we've decided to drop that one for today. So this covers product, pricing, place, and promotion. So product is all about your practice. What is your practice? Who are you going to be your patients? How are you going to kind of serve them and treat them? And why is someone going to choose you over another clinic? Pricing is all about how patients are going to pay for your services, the different models that you can look at, and how you're going to have revenue streams for your business. Place, which Paul will touch on, will be about how you're going to deliver those services to your patients, but also about your online presence and where patients can find you. And finally, the world of promotion. So once you've got everything set up, you have your website, you know, you've done all the groundwork, you've got your CQC registration, you then need to go and find some patients. So where are you going to find them? And once you've found them, how are you going to retain them to ensure that they keep coming back? So that's the areas that we're going to cover today. So when we talk about products, you know, one of the things we always sort of challenge our clients with is around, well, tell us about your practice. Can you describe it in 30 words or less? You know, succinctly, consistently. This is going to become really, really important when it comes to the marketing for your clinic, because that messaging, that kind of value proposition in that 30 words needs to be on your website. It needs to be on your email marketing. It needs to be what your patient care team is saying on the phone when they call up. It needs to be on your social media. So having that kind of, that 30 words, that value proposition, but also those kind of key USPs are really important. So you'll hear this term value proposition. I mentioned it a lot in webinar 1, but it's about really having a clear understanding, you know, about your clinic and how you're going to meet your patients' needs. So the idea of who your patients are going to be, and also who are they not going to be, who are the patients you don't want to attract, what are those kind of services and treatments that you're going to be offering, and what are not only what those treatments are, but what are those benefits that they are going to be delivering to your patient in terms of quality of life or restoring health. Those unique selling points are really important too. What is different about your clinic compared to the other clinic down the road? So making sure you're very clear about that. Now, part of that process is going through a competitor analysis, or what we call a market positioning exercise. And it's that idea of gaining an understanding of who you'll be competing against in the market, what are their strengths and weaknesses, and how are you going to compete. This is the private sector. Patients have a choice, so they'll need to understand where you sit, and will your values and will the benefits match their needs and requirements. So this is just a very typical kind of model that we use when we're working with our clients, but it just demonstrates very simply, are you going to be a generalist clinic which is offering a whole host of services, or will you be a more specialist where you're actually kind of looking at a niche and you want to become the best at what you do? Likewise, when it comes to kind of like price and value, are you going to be at the more affordable end of the market, or are you going to be going at a more prestigious and premium level? So all of this will determine your pricing, your promotion, the way your brand looks. So something that's really important before you set out. And once you've got a clear understanding of what your value proposition, what your clinic is, it's worth going through that exercise of, what does your ideal patient journey look like? Not where you're working currently, but this is your practice, this is your vision. What does that kind of pathway look like? So think about that first initial kind of contact that patient's going to have. It maybe they're Googling online, they've come across your website and they've landed on your page. What do you want them to do? Is it because, do they register for a newsletter? Are they signing up to something? Is it a discovery call? They then move on to kind of week one where they've paid for their consultation. So what does that journey look like? Then perhaps further testing and investigations. Then perhaps the journey is that you want them to start to enter into a subscription model where they're paying you on a monthly basis for certain services. Then you've got review consultations and further testing. So this will be unique to each and every clinic. So you'll have an idea of what that patient journey is. Now, once you've mapped that and got a good understanding of how that's going to look, you then move on to the next stage, which is, what are the processes, the people, and the technology that are underpinning that patient experience? So you'll look at that again, that journey that we've just taken that patient on. So what about the people? So the people is, well, the clinical team. What are the doctors? What are the nurses? What are the healthcare assistants going to be? Where are they going to be involved in this process? Also the non-clinical team. What will your practice manager be doing? What will your medical secretary be doing? So you need to be thinking about the people that are involved in your business and how you're going to deliver that patient journey consistently. We then move on to processes. So what is the process that's happening at each of these stages? So when someone submits an email address on your website, where does that email go? Which patient management system does it go in? What about the onboarding or registration process for a patient? All of these will be unique depending on your clinic and the field that you're operating in. And then once you get into retaining that patient, how are you going to update their medical records? What communications are sent out? All of these are processes that you need to map. And finally, a really important area that we'll be covering a lot more, I think, in webinar 3, which is around the technology. What is the tech stack, is a term that we often use, the different technology you're going to be using to underpin that patient experience. It's going to sit under your clinic. And that may be a practice management system. It may be what we call a customer relationship management system, which collects data and sends out communications. So there is often a mix of technology. It could be your phone system. It could be your email provider. Are you going to set up with Google? Are you going to set up with Microsoft in terms of your email? All of these things are really important because you need to really test this kind of patient journey thoroughly before you go live, because what you don't want to be doing is going live and find out on month 4 that there are cracks in the experience. People are falling through the cracks. Now, while we touch on that, and we touched on this on webinar 1 as well, is what does that day-to-day operations look like for your clinic? So if you're going to go solo and you're going to be doing everything, that's great, but you may want to start thinking about building a clinical team and a non-clinical team. So Will you be bringing on a practice manager? Will you be bringing on a medical secretary? What are those roles and responsibilities? Are you clear in your mind about what they're both going to be doing? And then what about the commercial aspects? So who's going to be doing your marketing, maintaining your website, sending out your newsletters, bringing in those new patients that Paul's going to talk about in just a moment? And then what about your bookkeeping and accountancy? That's something you need to think about. Now, these are not all full-time roles, but they are functions within a business that you need to think about. Now, aligned with your product is your brand and vision. And we go right the way back to the very start, which is that idea of why you're getting into private practice, your private practice, and what is it, and what is it, was the name and the logo. That's an important part of your brand. Also your icon, what does your icon look like? That will be synonymous with your brand. The favicon is the icon that appears in your web browser. So all these things need to be thought about. You'll need to be thinking about the colors that you want to be using consistently. You can't just continue to use random colors. There'll be colors that are synonymous with your brand. We then think about typography and imagery. What's the style of imagery you want to use? And then what about wording? So what about copywriting on your website? What's that tone of voice that you want to come across? Is it going to be kind of like more informal and helpful and warm and friendly, or is it going to be more authoritative? And that will depend on your brand and the vision. And then think about the personality of your brand. So when someone picks up the phone to answer the phone, what is that tone of voice at the other end of the phone? All of these things are really, really important when it comes to brand and vision. So Paul and I kind of got together this week, and we thought we'd give you a quick sort of 5 top tips on branding. So building a strong brand identity is important for any healthcare practice. Firstly, you need to check the name of your clinic. So check it with Companies House, make sure no one else is registered under the name that you've been thinking about for the last 6 months. That's really important. And also, has the domain been registered? So typically a .com is more powerful, a .co.uk is great, but if you start to go down the list, they're going to be weaker domain names. So you need to think about this and do that in your planning phase. Think about your future patients. If you're going to be going after, if you're a Harley Street high-end clinic that's attracting high net worth individuals, then your brand is going to need to reflect that. It's going to need to look and feel like a prestigious high-end premium brand. So that's going to have implications for your design and your designer, which again, Paul's going to come on to in just a second. When you're thinking about your logo, we often recommend that you start sketching in black and white. What does it look like? Is there a particular shape you like? There's always personal preferences, but remember to keep it simple. So if you think about the world famous healthcare brands, whether it's Bupa or Nuffield Health or some of the big pharma companies, the logos are always simple. And the number one fault we see with clients when they present us with their logos and their ideas is they're trying to pack too much into it. Think about mobile. The majority of your patients will experience your clinic on mobile phones. So therefore, if you've got a very complicated logo, it's just not going to work on a nice small screen in a portrait format. So you need to be thinking about that. And then one of the things that we recommend is building a set of brand guidelines to support your brand. And that will act as a flexible toolkit for you going forward. So that will include, your logo lockups. It will include your color palettes. It will include the typography that you like to use. It will include the style of imagery. So all of these things will reflect how you present yourself and how you market yourself going forward. So 5 quick top tips there for branding. But like we said, do get in touch if you want to talk about that in any more depth. So we're now going to touch on pricing briefly before I hand over to Paul. So this is all more around how you're going to price your services, how you're going to charge, what are you going to charge, how you're going to take payment. But one important point here is that you need to be clear and upfront with your pricing. We find many clients will try and bury the pricing in the website. It will be at the bottom of a page about us or somewhere. It's probably one of the most sought after pages or visited pages on a website. Once someone's bought into your practice and who you are and what you do, the first thing they're going to be looking at is the services that you offer and how much they cost. And you'll be surprised by the amount of websites that we come across where it takes 4, 5, 6 clicks to find the pricing. So be upfront and clear. This is really, really important. Now, we touched on this on webinar 1, which was what are the factors to consider when you're looking at your pricing and your fees for your clinic. But I'm just going to touch on a couple of these here. One is about your specialism and the scarcity of the service that you provide. So if you're in central London and you're the only practitioner that can deliver a certain treatment or treatment of a condition, then the likelihood is you're going to be able to charge a higher fee because your service isn't ubiquitous. It isn't available everywhere. The same with target market and location. If you're going to be in the heart of the medical district in London, you will have an opportunity to perhaps charge more than if you're on the outskirts of London or in a provincial town. So, considerations to think about regarding pricing and fees. And again, we've got webinar 1 to refer to. One of our golden rules is no to discounting. We feel that in private medical practice, you shouldn't be thinking about discounting 50%. You should be thinking about how you can add value to your patients. Moving on with pricing, key considerations. So this links back to the business planning. What are those revenue streams going to be? Yes, you're going to charge for your consultations, but what else are you going to be charging for? Are you going to be charging for blood testing or for investigations or for letter writing or referral letters? There are many models out there. You'll need to think about that in terms of your patient journey that we mentioned a few moments ago. What about your model for private medical insurance and self-pay patients? Will that be different? Do you want to attract more self-pay or more private medical insurance? And that will come down to the individual clinic. Will you be looking at a pay-as-you-go model, or will you be looking at subscriptions? Will you be taking a payment or a deposit up front? It's very common now for patients to pay upfront online booking rather than invoicing after consultation. That, in our opinion, and in my opinion, causes a lot of kind of admin after the consultation, chasing up payments, chasing up invoices. It can be a very laborious task for your admin team. And thinking about payment plans, we are in the middle of a cost of living crisis, so affordability is key. Disposable incomes are under pressure, so coming up with payment plans where they can spread the cost over a quarterly basis or a monthly direct debit is very, very important. And who is going to chase those kind of payments? So, if you have thousands of pounds of debt over the course of the last kind of 3 to 6 months, who is going to do that in your team? How are you going to chase it? It's important. It's an important consideration alongside cancellation and postponement charges too. These need to be put in your T's and C's and be very clear to your patients. So if someone cancels within 24 hours, they need to know that they're going to be, will they be able to get a refund? Will they be able to reschedule their appointment, or will they have to actually pay that, that initial consultation fee? So just some considerations there regarding pricing. So I'm now going to hand you over to Paul, who's going to focus on place and promotion.
Thanks very much, Simon, and nice to meet everybody. So yeah, as Simon's already outlined, 2 key factors there, the product and the price. So now I'm going to start by going through the place, which is another key element of the 4 Ps in this marketing mix that we're talking about. Now, place, in other words, means distribution, i.e. how do customers find you? Where are they? Where do they go? So number 1 key question here is, how are you going to deliver your service to patients? So deciding whether it is purely a physical clinic location where patients have to come to you, or are you going to have a virtual model or even a hybrid model where you can have online appointments where you'll need a website potentially and also online facilities to allow that to happen? So a key decision when you're thinking about this is, where do patients want to come and access your service? And then key question number 2 with the place and the distribution is, what channels are you going to use? What distribution channels will you use to make patients aware of your products and services? And the key question to ask yourself here is, where do patients look for information about your service? It might not always be the obvious places. So what I'd like to do next, on the next slide, please, Simon, is have a look at some distribution channels just to give you an overview of ideas of where you can actually look for other distribution channels for your patients. So number 1 I've put up there is a website. I'm going to talk a lot more about websites in a few slides time, so I will come back to that. But the obvious thing for me and a lot of patients these days, when you're looking for something, where do you go? Our friend Google, we go online, have a look and see if we can find that information. And Bing as well, which is another search engine. So think about having your online presence, number 1. That's a key channel where people will go and check things out and find out what you do. But there are others. So it's thinking about review websites like Doctify, Google reviews, making sure your profiles are up to date, they're optimized. They even have links back to your website perhaps as well to build that authority as well. And Google reviews are very, very useful to build that profile, which you can do with something called Google Business Profile, which is a free profile that Google gives any business. If you haven't got one, it's easy to get one. We can help with that. And if you have got one, we can help optimize that. So it helps people find you in search engines when they're looking for particular things. But some other distribution channels which are really effective, which a lot of people underestimate the value of, are things like partnerships and collaborations. So a lot of the clients that I've worked with in the past, they found real benefit from this. So it's thinking a little bit differently about where your patients go to seek information about your service. And it might not be the obvious places. It might be associates that you could collaborate with. It might be organizations. For example, it could be workplace organizations like the Chartered Institute of Personnel. They might have work events where you might want to collaborate with them to deliver seminars or webinars on a particular work-related issue where you know your target audience might be. And I'll come on to that a little bit more detail to explain that. And also publications. Are there any publications out there that your potential patients read and interact with? If so, how do you get involved with them? How do you get your name in front of them in those publications? So essentially, we're looking, where do your patients look for information? So next slide, please, Simon. Thank you. And this is the key slide for me. Of all the marketing slides that I'm going through today, if you want to go back to one, this is the main one to go back to. And it's about who your patients are. Because I'm sure you'd agree, if you don't have patients, you don't have a clinic, you don't have a practice, because you need patients to come in there and also repeat business as well. So what I've got on the screen here is a customer persona. Now, this is a semi-fictional representation of your potential patients. So if we're thinking about setting up a health clinic, that health clinic can have many different patients in there. So I've created some semi-fictional characters here. So we've got Gemma on the left, who's 27. She's a graphic designer. She's based in Manchester, and she's looking to set up a family in the near future, but she's very much into her health, fitness, and nutrition. And she's also always seeking health blogs out to look for information. So at the bottom there, I've put in what her search intent may be if she's looking for something. So it might be how have a healthy pregnancy. So you might then have to reflect your content on your website, on the events you host, on the collaborations you have, where that information might be sought from. So thinking about blogs around that, perhaps. Amanda, 49, in the middle there, she's a managing director based in London. She's married, got 4 children, and she's looking for help with the stress at work and the work-life balance, and actually thinking about when she retires. She wants to stay fit. She knows she needs to do something. So her core search for intent might be how to reduce work stress and improve well-being. So again, thinking about where Amanda may go for that information. And this is where workplace events may come in, partnering with organizations that share that information in the workplace. And finally, we have Mary, 67, who's a retired teacher, and she has recently had a health scare, but she's looking to keep fit and active because she's always volunteering at local events, and she uses Facebook to find information and also liaise with her friends. So she might be searching for how to improve health with limited mobility. So again, changing our narrative to suit the different client audience is a key thing when we're looking to develop the promotion in our marketing activity. So I know that's a quick tour of the customer personas. Quite happy to answer questions on that or have a chat with anybody on a one-to-one basis as well to go through that in a little bit more detail. So the key question we want to ask ourselves or want to achieve from promotion is, number one, how will you acquire new patients to your practice? Because we need new patients when we're starting out, obviously, but also very importantly, how we retain existing patients. So what we need to decide there is how we communicate effectively and which channels we're going to use. There's a wide range of different promotional methods that you can use, but as I've just explained there with the different customer personas, it isn't one size fits all. We need to be selective of which channels we're going to use to target each individual customer persona that we develop. That's why it's so important to develop that customer persona for your individual practice. So if we move on to the next slide, please, Simon, we'll take a look at an example of some channels you can choose from. Now, don't fall off your chairs when you see all of these here. I'm not expecting you all to do all of these channels. On the right, there's a graphic with a lot of ideas in there, community-based presentations, paid-for channels, and written channels. But what I want to draw your attention to this evening is on the left-hand side, a little bit of a system that I think works really well when you're thinking about how to promote your business. So first of all, website. Number one, this is where all your information and content should be housed. And I've got a slide on that coming up shortly to go into a little bit more detail to give you some top tips on that. But say, for example, we create a blog for Mary about how to get fit and stay active. So we put that on our website. We then may choose to do some SEO, search engine optimization, and possibly also SEM, search engine marketing. Now, these two words can be quite similar, and they are quite similar. The key difference is SEO tends to be organic, so you will make it attractive, your content on your website, to search engines. SEM tends to be paid for, things like Google AdWords, as an example. Now, depending on your budget and what you want to achieve, you may do a mix of both, or you may start with one and develop into others. But just be aware that these things exist and they're important to raise your website profile once you put content on there. But say we've created that blog, we do some SEO, we then might share it on social media. So we choose the channel that's relevant to our customer group. So in this case, Mary, who wants that information, we know she's using Facebook, we'll share that on Facebook and do posts on there. We may even change that blog into a video and do a short video. And we create a YouTube channel to do that, which is another way of creating a great presence online, another search engine that people use to find information. So what we're doing is working smarter here. We're repurposing content from our website to create a blog, to create some content for our social media, and then also to share it as a video as well. So we're repurposing that content. We may also use email and newsletters to build up a client database. And this is a crucial aspect. Simon touched on it earlier about how you collect data from your potential patients. So we need a process in place that is GDPR compliant, where we can get people to sign up, for example, to a newsletter. So you can send information out to them on a regular basis, and also not overdo it, but give them information of relevance. It's about communicating information that they're going to find useful. And then you may develop into collaborative events, webinars, or podcasts. You may not want to do these yourselves because they can be intensive to set up, although we can assist you if you did want to look at that as an option. But there are partners you might want to work with who host events and webinars regularly. And that's an opportunity to be a key speaker, share that information on your website and share it to your potential patients as well. And then finally, review websites, which I've mentioned earlier, looking at other websites where you can put your details on and have reviews on there and create an online profile. So I know we haven't got lots of time to go into this evening, but there's a few ideas how to create a bit of a system and plan your promotional channels. So if you can go up the next slide, please, Simon. I just want to finish off by giving you 5 top tips. Simon gave you top tips on branding. I'm going to give you some top tips on websites. And I think the first one is you do need a website, any business does, but particularly now, when you launch your practice, you need that to show the CQC when you're launching. So my top tip number 1 is make sure it has good design. And this may sound obvious, but what I mean by this is, has it got a clear message? Does the brand that Simon related to earlier stand out? And do people get what you do straight away? They're not going to have a look to find out what your practice offers. So is it easy to navigate with a structure that's easy to find that information as well? Is it mobile responsive? A big thing these days, because a lot of patients will view your practice website online using a mobile device, mobile phone or tablet. So making sure it's responsive in design, and also the way you lay the copy out onto the page. We call it something called a layer cake design, which means it looks like a cake when you cut it in half. So what I mean by that is if you cut a lovely sponge cake in half, you'll see some layers of jam, some sponge, maybe some other layers of chocolate, whatever you like in your cake. But on a website, what that means is you need a headline, you need some text in explaining what you're talking about, then subheadlines to break the text up into bite-sized chunks. Because when you're surfing the internet, especially on a mobile phone, you don't want a wide range of text to read because people will just jump somewhere else. So we make it easy for them to navigate. And it's called layer cake design on the page design. We then also want to talk about a call to action. Make sure you have a clear and actionable process. So an obvious one is have a book consultation, but that maybe goes to an online booking functionality. Again, going back to what Simon talked about in your product, in the process, how do you take those bookings? Is it automated? And making sure you collect those details. But you could also develop other call to actions, which links into your content strategy. So you may have something on there that you have to sign up to a newsletter, and that's a call to action. Download a patient information fact sheet, or even have a video for somebody to watch. So decide what your call to actions are and make sure you have a process to make people engage and do those things that you want them to on your website. And then above all, number 5, monitor and review. It's pointless putting a website live and not reviewing it. It needs nurturing on a continual basis with regular updates with content and information. And Google Analytics is a platform that will help you to do that. It will show how many visitors you get to your website, who's coming from which sources, any referral sources, and also what people do on your website, so we can decide what content we may need to change and improve. So it gives us lots of insights to help develop and improve your website. And if you're thinking about getting a website or already have one, we do offer a review where we can have a chat with you on that and see how we can help. So just shout out if you need any help with that. So with that said, I'm going to hand back to Simon, who's going to give us a review of the key steps that we've gone through so far.
Yeah, thanks, Paul. Some really good tips there, I think, relating to websites and promotion. I think there are so many different channels you can look at when it comes to promotion. You know, you're absolutely right. You just got to map it back to your audience and which of those that are relevant. I think we see a lot of people getting obsessed with kind of TikTok and kind of like Instagram and the fact that they need to be there. But if your patients are not going to be there, there's no need to be there. Yeah, quick summary of today. I hope everyone's found this evening's webinar useful. So product, really about knowing your practice, that idea of like, can you describe your practice, whether you're up and running now or you're going to be running up and running in the next 6 months? Can you describe it in 30 words or less? Imagine someone approaching you at an event, a medical conference, and saying, well, tell me about your practice. What is it? You need to have that kind of pitch, you know, that 30 words really kind of clear and concise, and that idea that, you know, you can really clearly communicate your USPs. Pricing, obviously be clear on your website about your pricing and how people can engage and buy your services, but in how much are they going to pay and how are they going to pay? The idea of pay-as-you-go model, or whether just paying for consultations, or is it more of a kind of subscription offering? And that's becoming a trend. We're seeing that happening now in private healthcare, where more and more clinics are moving to a subscription model where they provide services throughout the year and there's a monthly direct debit taken at the end of every month. Place, which Paul touched on in terms of, you know, are you thinking about an in-person physical clinic? Is it going to be online only? Is it going to be a bit of a hybrid? Think about that aspect in terms of how you deliver the services, but also where are people going to find you when they're searching for you? Where are they going to find you on the internet? And then finally, promotion, which obviously Paul talked about, which is about the idea of prioritizing a website, the need for good design. You can't get away with a badly designed website anymore. And when you are thinking of, once you've got that website and it looks great and you're really happy with it, then what are you going to be doing in terms of promotion to going out there and finding new patients? There are so many channels. There are so many opportunities to waste money as well. So that's something that you need to think about. So again, do talk to us. We can point you in the right direction. We can give you sound advice. We've been through this many times before. We can tell you the channels and the approach to take, which is going to work for you. We have time for questions. Please use the Q&A function or the chat function to ask any questions that we might have. I think we've got a couple, Jane, have we?
We have got one, which is a really good one, actually. I was under the impression that people were now looking at Instagram, YouTube, or TikTok for information, even on medical services. And I mean, this is a really, really good question. And, I'll say a little bit and then I'll hand over to you, Simon and Paul, because I'm sure you'll want to add to it. But, I think, when we're thinking about marketing our businesses, we need to keep reviewing what are the right channels for us to be using in terms of social media. Now, if we think about something like TikTok now, I was reading something in the newspaper recently that said most young people get their news from TikTok. They don't read newspapers. They don't listen to the BBC. They get their news from TikTok. Now, that is really scary because obviously there's an awful lot of interesting information on TikTok. But I think the point that I'm trying to make is that if you look at our younger population, they are relying on TikTok for information. So absolutely, if they were looking for healthcare information, that might be where they would look. And anyone who took part in the London Marathon of that age group, if you look on TikTok at the moment, it is absolutely swamped with people who took part. So if you were a physio and that age group and those people were relevant patients for you, then TikTok could be a really, really good place for you to be. And then I just want to bring it back to look at Facebook, which has been around a lot longer. When Facebook was first introduced, that was something that our younger generation were using. And so for a lot of business people, it wasn't particularly relevant. But if you look at Facebook now, most of the people using it are 40 plus. So it's a completely different demographic to what it was sort of even 5 or 6 years ago. So I think we need to keep continually looking at all of these platforms. But the key thing, and I'm sure Paul will pick up on this as well, is you have to go back to those customer personas that Paul talked about. You know, you have to think about who is your ideal patient and where are they looking for information, and wherever that is, that's where you need to be. So if your demographic is not the very young, then TikTok probably isn't the right place for you, and you would be wasting time and energy on that you might be better spent somewhere else. So that's my view. But Simon and Paul, please feel free to share your views as well.
Should I let you tackle personas, Paul?
That's right.
I was actually going to talk about data. So I was going to talk about the need to really think about return on investment, and marketing, you know, is about return on investment. Any good marketing director in any large organization in the world will be thinking about, they want to generate more money for every pound they spend. They want to be generating more than a pound. And I think what you need to do is be thinking about all the marketing channels that Paul kind of outlined. You may want to test some of those channels, and you need to have the beauty about digital marketing these days is you've got complete transparency. You can see how much money you're spending. You can see how much traffic you're generating to your page. You can see how many people are registered, and you can see how many people then are then converting to a new consultation or actually paying you money. So you have that transparency, so you can test these channels. But the whole idea here is absolutely what Jane said, which is about relevancy. We do see a lot of people getting really obsessed by kind of TikTok and Instagram and worrying that they're not on there and they're not doing videos. But ultimately, if your audience isn't on those channels, they may be in print. You know, I'm working with a client at the moment in West London where, you know, they're looking at high net worth individuals who are 50 plus. You know, as Jane said, you're not going to find those kind of people on TikTok, or maybe you might, a handful, but the proof is going to be in the pudding. It's about, looking at what you're doing with your marketing, measuring the performance of that marketing and seeing which of those channels is working best, and then doubling down the investment on those channels that are working and dialing down the ones that aren't. And so, Paul, I'll hand over to you to talk a little bit more about personas.
Yeah, thanks, Simon. I agree with both of those, what you've just said there. I think it is important from a marketing point of view to start with those personas. So it is deciding where your audience is going to be, as Jane emphasized there. I think just taking on TikTok, I think it is a popular platform, but one other consideration is, as a business, as a clinic, have you got the time to devote to create good, relevant content as well to put on there? And that's a conversation I've had with a few clients, because although you might think you need to be there, one, can you be there as well and actually facilitate the content that requires as well? If you can, great, and that could be a model that you then look at, but it must be relevant for that client audience that you're looking to target. I think YouTube, I think for me, is a great one to start with as an example, because that allows you to have a wide range of different users looking at you. So if you have a YouTube channel for your clinic, you can house your own video content there. You can then embed that on your website. People can search for you via YouTube as well. So I think if you can invest any time, it would be in create engaging content, useful videos that you can share with people. And then also choose one that you want to do really well. Don't feel you have to do all of them all at once, because you may water yourself too thinly, spread yourself too thinly, and then actually don't do them all very well. So think about who your key customers are and focus on that demographic and what platform they're using, and do that well rather than spread yourself too thinly to begin with.
Well, that's good. Thank you, Paul. And we've just had a comment here that I agree with. The content we create should be usable across all platforms, in my opinion. And, I 100% agree with that. I mean, I think creating any content, whether if you're writing an article, it's a huge investment of your time. And it's important to think about how you can use that in as many formats as possible. So you might want to write the article, you might then want to make a video that, is almost the same content, but you can then put that on YouTube. You might take different snippets of that video and use that on Instagram or TikTok if that's a place you need to be. So I agree, any content you use, you should be looking at using it multiple times. Paul and Simon, do you want to add to that?
Well, I definitely agree with that. I think repurposing is a key thing. Work smarter, not harder. So invest your time in your content planning of what you want to say. Make sure that is on your website, but then work out the channels you're going to share that on. So as you say, Jane, it could be small snippets. So one blog might create several kind of posts on the platform of choice for your audience, and then create a video. So it's the same content on video. It's just investing time to set these things up, because they don't happen overnight. You have to set the time aside to plan it and make sure you get them across all channels as well.
Yeah, absolutely, Paul. Not much more to add there, really. I think the importance of planning. I think when you start your kind of marketing for for your clinic, you should have a plan of what the activity you want to do over the course of the next kind of 6-12 months. You should have a marketing budget that's associated with that too, in terms of the budget that you want to spend. So where you can kind of create content, which I think is a term called evergreen, which can keep coming back and you can reuse and repurpose, is absolutely key. You don't want to be spending a lot on production. What works very well, and I've seen it work very well, is themed content. So the idea that you write a series of blogs, you do a webinar, you've kind of got videos, you can start thinking about, perhaps events that are happening in the calendar, which are going to attract a certain kind of audience. That's quite a nice way to plan your content. But no, I think you've covered it well, Jane and Paul.
Yeah, good. And yeah, another really, really good question. And I've had this conversation with people many, many times. How do we know how much money to allocate to marketing? Now, that is a very, very hard question. I think, and I've done quite a lot of research into this, looking at, is there a sort of standard percentage that companies tend to invest? Do people look at putting 10% of their turnover into marketing, and there isn't anything that you can really rely on. I think it comes back a lot to what Simon said. It's about return on investment. There is an argument that says that if you invest £1 and it brings you in £100, then you want to really put as much money behind that mechanism as possible, because that's working really well for you. So when you can demonstrate the return on investment, it gives you the confidence to invest more. But when it comes to deciding how much you're going to invest in, say, the first 6 to 12 months of your practice, that's obviously a difficult decision, and it's going to depend a lot on what resources you have. Available in terms of money. But I would also not underestimate the amount of time you need to invest in marketing as well, because that is a significant factor to consider as well. Again, can I open Simon and Paul, your thoughts on this one?
Yes, it's a really good question. I think, when I was a marketing director a few years ago, I think there was a general sense that somewhere between sort of 5 to 10% of your overall kind of turnover should be invested in marketing as a general rule. But if you're in a growth phase and you're just launching, then the likelihood is you're starting from scratch. You've got no patients, so therefore you're going to need to invest more. But the return on investment argument is very strong. I think you need to plan for this. You need to be thinking about your KPIs, which we'll come on to, I think, a lot in webinar 3, which is, what is the business plan? What are your revenue targets for your business over the course of the next 12 months? If it's £10,000 a month that you're looking to generate for your clinic in the first 3 months, then how many consultations do you need to get, in order to kind of hit that number? So what level of marketing do you need to do to generate the number of leads, or the number of kind of new patient inquiries, converting at 10% to generate that number of new patients? So it's quite a methodical way of working, and it comes back to the idea of kind of business planning, making sure you're putting a budget together and making sure you're thinking about this in great detail. But I do think you've got to trial, when you launch, you do need to trial different channels to see which one is going to work. You may have some assumptions around, I really think that, social media is going to be for me, or it's going to be around kind of Google advertising, or I'm going to spend a lot of my time on really good quality content with SEO. But until you've kind of done that activity and started to measure the impact, you won't really know. Ultimately, the truth comes in the data. But you need to start somewhere. So I think year one, I think you do need to invest in marketing. You need a website. You do need to look at those promotional channels that Paul's talked about, and you do need to have that analysis kind of in place to understand where that return on investment is coming from.
Yeah, I think I would just add on top of what Simon said, is think about investing time up front on the strategy side. So thinking about who those customer personas are. And if you can come to the table with ideas that I thought about this, and this is how it relates to my product and service offering, then that saves time, and that kind of helps kind of develop the conversations about which channels to go to as well. So we understand that budgets are tight sometimes, and it's kind of deciding what's going to give you the best value and return on investment, as Simon and Jane have said. So I think it is that preparation. Don't underestimate the value of that preparation and planning what you want to say, who you want to say it to, before you then start using channels to distribute that content. spend time to sit about and then think about that upfront before you start sending those messages out, and that will save money in the long run.
Yeah, I'll just add to that point. It's absolutely spot on. I'll just say that I guess for your marketing, you need to think about two different aspects. One is going to be your media spend. So if you're going to go down the Google Ads route, or you're going to go down display advertising with Facebook, that is media spend you're going to be spending with Meta, or you're going to be spending with kind of Google. But there are many marketing channels that actually don't cost money as such. They are more about your time and your energy. So Paul touched on partnerships before. So if you've got another clinic that is serving the same market as you are, but offering complementary services, then joining forces and running a webinar on a really popular topic, and actually then generating interest in that and posting it on social and building an organic profile and kind of like momentum can be very powerful. It's going to take up a lot of your time, and you need to think about that. But sometimes there is a misconception that marketing can be very expensive, and it doesn't need to be. But you will need to allocate a certain amount of time to it.
And I was just thinking about the ways in which we could help with that. If you were looking at, trying to create your marketing budget, one of the ways in which we could help is we could give you some guidance on, a website can range hugely, but we could give you some guidance that says, for this kind of size of website, this is the sort of price you're looking at. In terms of SEO, this is the sort of monthly expenditure you're looking at. If you were looking at paid advertising, again, we can give you the sort of minimum budget so we can help you with that. So if that's something that you would be happy, that would give you some guidance, then let us know, and we can talk you through all of that.